Welcome back. Community care services help veterans obtain care that the VA cannot provide. Dr. Jennifer Harbaugh, the Chief of Community Care, joins us now to talk about community care. Welcome to the show, Dr. Harbaugh.
Thank you for having me.
It's good to have you here. So let's talk about that. What is community care and how does it work with the Mission Act?
So community care is the program that Congress allows us to have money at the VA facilities to purchase care and services that VA cannot provide. The Mission Act was a congressional act rolled out in June of 2019 that provides the eligibility standards that allow us to use the benefit.
Oh, that's wonderful, isn't it?
It absolutely is. It helps us to bring the care to the veteran rather than having to send the veteran for care.
Can you give us some examples of things that you might?
Sure. So some of our veterans require services that, number one, we don't provide specifically in VA, such as maternity care or home health services. So we can contract with our local facilities and agencies to get that care to the home or to the veteran. They do have to meet the eligibility standards. They have to be within a 60-minute drive time to the VA for services that we do provide, mostly specialty care and primary care and mental health, 30-minute drive time.
Okay, so there are some misconceptions. Maybe we should talk about that a little bit.
Sure.
Go ahead. There's some gray areas, like not all veterans are eligible for CC?
Yeah, so community care, again, has specific eligibility guidelines. So if we have services within the VA that we're providing, the veteran automatically has to be greater than that 60-minute drive time to be eligible for community care. We want to provide VA services to veterans, and we only use the community care program when it's absolutely necessary.
I understand.
Another myth we like to debunk is that community care is not forever. We have time-based referrals to the community, and so you might only be authorized for 90 days or 60 days, depending on that specialty of care. And so it's really important to track that pre-authorized service benefit to ensure that you're not going to get a bill for services.
I understand. And the James E. Van Zandt Medical Center doesn't have an ER at any of the locations. So what should a veteran do if he or she is in need of emergency care?
That is correct. So under the Mission Act, because we don't have that emergency care, all veterans are eligible to self-present to a local emergency if they are having a true emergency and receive care. The component of that eligibility is that they must contact the VA within 72 hours to receive that authorization.
Okay, so there are some restrictions involved, yes, or some guidelines, I suppose. What else would you like people to know about community care?
We also have an option if you're not having an emergency and you need more than urgent care. We have an urgent care available at our Altoona VA 24/7. But if that drive time, again, is too far away, then we have the option for the veterans to utilize urgent care in the community. The difference between that benefit is they, again, have to call and get pre-authorization for those services.
Okay.
To help guide veterans through this very difficult process, we've created a couple homegrown pamphlets and business-sized cards they can put in their wallet with their ID card that helps them with that information, the phone numbers to call, the pharmacy benefits that they can access and such.
Where can they get a copy of these?
So we have these available at all of our outpatient clinics and specialty service clinics. All you have to do is ask one of the staff members and they'd be able to get you a copy.
Would you say it's a good idea for all veterans to have copies of these?
Absolutely. I think these are a new initiative we're putting out, but I think they are what veterans need to be able to utilize their community care benefits appropriately.
What else will they find in these pamphlets?
In addition to the emergency care and urgent care benefit information that's the same on the cards, they're also going to get a couple bullet points about the community care authorizations, that time-based information, and also what they need to do to continue care in the community if needed, how to contact our department if needed as well.
I think that's a wonderful idea, something to have just right there on the fridge at home in case you need it as a reference point.
Yes.
Well, Dr. Harbaugh, I want to thank you for spending some time with us today, and thank you all for doing such great service for our veterans. It's greatly appreciated.
Well, thank you for having me.
It's been a pleasure. That's all the time that we have for today. Thank you so much for joining us. We appreciate you so much. And if you're a veteran, please get to know the James E. Van Zandt VA Medical Center. We'll see you again soon on Fox 8 News Now.